Responders for Autism Zoomcast. I am your host, Rob Long, and today we're joined by Dr. Mackenzie L. Boon. Hello, how are you, Dr. Boon?
I'm good. Thank you so much, Rob. Thanks for having me today.
Thank you for your time. She's the behavioral psychiatrist in the Pediatric Development Disabilities Clinic at Kennedy Krieger Institute. Tell us a little bit about what you do at Kennedy Krieger.
Great question. So Kennedy Krieger, as you know, is an organization that serves children, adolescents, and adults with neurological or neurodevelopmental disabilities. I specifically work in the behavioral psychology department at Kennedy Krieger, and we provide a continuum of services for children and adolescents, both with and without developmental concerns that also have co-occurring behavior problems. Those could be externalizing behavior problems, so maybe things like aggression and tantrums. They could also be internalizing things such as anxiety or depression, and we really heavily emphasize within our department parent and caregiver involvement in our treatment.
Now tell us a little bit about your educational background, because when you came on, like, well, she looks young. I mean, she's Dr. Boon. Tell us a little bit about your educational background.
Great question. So I received my undergraduate degree in psychology from the University of Nebraska at Kearney, and from there I went on to receive my graduate education from the University of Utah, where I received both my master's degree in education and then my doctorate in school psychology. And from there, I was able to complete an internship and a fellowship after that at the Kennedy Krieger Institute, became a licensed psychologist in the state of Maryland, and then have been able to be fortunate enough to stay on as a behavioral psychologist as staff at Kennedy Krieger.
Now, you attended both Nebraska and Utah, very interesting combination. Where are you originally from?
I am originally from the state of Nebraska. That's home for me.
Okay. Well, welcome to Baltimore. Thank you so much for all that you do. Now, I guess my first question is, other than what I experience often, what exactly is anxiety?
Great question. So everyone experiences anxiety, right? We all have fears, we all have anxious symptoms, and it's something that is actually helpful to us, right? If a real threat or danger is present, we want those feelings to kick in, right? If something's lobbying towards us, we want adrenaline to kick in to protect us. Anxiety may also kick in, though, when there isn't a real threat or danger present. And instead of being helpful in protecting us, it can be hindering to an individual. Anxiety disorders specifically are characterized by excessive fears and worries that also may result in physical symptoms for the individual. So they may have things like a stomach ache or racing heartbeats. And these feelings and these symptoms cause distress for the individual. It really impacts their daily life and it impacts their daily functioning.
Well, I guess throughout this pandemic, a lot of us are becoming very anxious, but how common is anxiety in children or adolescents with autism?
Absolutely, you're right. The world currently is experiencing an increased level of stress. Before we talk about individuals with autism and anxiety specifically, I think it's important for us to talk about how common anxiety is in typically developing children and adolescents. The American Academy of Pediatrics estimates that 8% of all children and adolescents experience some sort of an anxiety disorder. We know that the risk of an anxiety disorder is much higher for that of an individual with autism, and this is true regardless of their age, their cognitive ability, or the severity of their autistic symptoms. Specifically for youth with autism, initial research was really widely varying, right? It was suggesting that anywhere from 11 to 84% of individuals with autism had some co-occurring anxiety disorder. More recent research, as we've sort of progressed throughout that, is suggesting that approximately 40% of individuals and youth with autism experience some sort of co-occurring anxiety disorder. And this can be things such as generalized anxiety disorder. They may have a specific phobia or fear. They may have social phobias. They may have obsessive compulsive disorder, or they may have separation anxiety disorder, have difficulty separating from a caregiver.
Now, I know growing up, my son was on the spectrum. He had those moments, those episodes of anxiety. But now, again, as we alluded to, we're in a different situation right now. You may have adolescents, children on the spectrum who are noticing a lot of things have changed. Things are different right now. Should parents in that situation treat it differently now that we're in a very rare and unique situation?
That's a great question. You're right. Kids are experiencing an increased level of stress and anxiety, and so are their parents. And the answer to that is no, we shouldn't respond any differently than we typically have been, right? We're going to talk a little bit later about how we can really support individuals with autism and how caregivers can support them. And the responses now during this increased time of stress would be no different than it would be typically for your child.
Now, let's say you at home, you have child on the spectrum, and you don't really know what anxiety looks like. You don't know what does anxiety in a child with autism look like.
Absolutely. So children and adolescents with autism and anxiety express anxiety in similar and dissimilar ways in comparison to their peers and in comparison to diagnostic definitions. So uniquely for a child with autism and anxiety, they may display insistence on sameness, inflexible thinking. They may have very low tolerance for change and uncertainty. You may see an increase in their restricted or repetitive patterns of behavior, and they might have increased rituals and compulsions. We really believe that we see an increase in these behaviors for the individual to try and exert some control over the environment, right? They're trying to make their world somewhat more predictable in some way. They're trying to cope and minimize that threat that's immediate to them. And if you think about it, I mean, certainly during the time that we're currently living in, things are much more unpredictable, but just even, in daily life, when a child or youth encounters a social interaction, right, that in and of itself can sometimes be unpredictable. So that we see things come up amongst those social interactions. We may also see anxiety present as behavior problems. So we might see anxiety be displayed as increased aggression, increased tantrums. A child may engage in self-injury. They might avoid social situations. Their sleep may be disrupted. They could have negative thoughts about themselves that then leads to subsequent depression and loneliness. Really, it can be either, those increased in that inflexible thinking or these behavior problems. And I think the one thing to note is that anxiety and autism can be really challenging to disentangle, right? You probably heard some presentation overlap, right? If they're anxious, they might have those restrictive, repetitive patterns of behavior. That's also a core feature of autism. So it's important that that families are seeking out support of a licensed professional to really disentangle that. And it's also important that we have professional support because the child may have difficulty really expressing and reporting on those internal symptoms and those internal experiences that they're having, right? And this may occur if they have a co-occurring diagnosis of intellectual disability, ADHD, or depression. And so the help of that licensed professional will be very important in terms of determining what's appropriate for that child's age, what's appropriate for their developmental level, and do they have an anxiety disorder or diagnosis.
Dr. Boon, again, just from my experience, these are very precious moments, and you can miss those connections and those opportunities. How important is it for parents of children and adolescents with anxiety? How important is that phase for them to really connect with their child?
Absolutely. It's really important for us to be, especially during this time, like you said, there are so many precious moments. We're probably spending more time with our children. And it's really important for parents to be able to manage their own stress and anxiety, to be able to be present with their children and be able to connect and really appreciate those moments.
Now, when I'm experiencing anxiety, I have my own tools. I have things that help me get through that. But a child who's on the spectrum may not understand what those tools are. What are some possible tools that we can help develop for children and adolescents to use during these times?
Sure. So the first step, like you have sort of mentioned, right, is that the child or adolescent has to even recognize that they're feeling anxious, right? They have to notice what that anxiety feels like. So the first thing that we support them in doing is recognizing what the physical symptoms of anxiety are, because those are often our first clues. So as I mentioned before, there may be a stomach ache, there may be a racing heartbeat, their muscles might tense up, they might feel sweaty. We really want to support them in cluing into what are those physical signs so that they can understand, hey, I'm feeling anxious, and here are some of the strategies that I need to use. Some strategies that we support youth with autism in using are first and foremost cognitive strategies. I like to say that anxiety likes to trick us. It sort of attempts to trick our brain and make things seem bigger and more imminent than it actually is. And we support the individual in using logic or rationale and truth in order to sort of fight back that anxiety. We're going to fight that anxiety with true facts and rationale and help us feel less anxious. That may be difficult for the individual to use in and of itself, and they may also need some other coping tool. So something else that they may need to do is use something like deep breathing, counting to 10, muscle relaxation, some sort of positive coping statement, like saying, I am safe, I'm okay. We like things like that because it's easily generalizable, right? You take those things with you everywhere that you go. Most importantly, when we're coming up with some sort of a coping tool for a child, however, we want it to be individualized to them. them. So if things like deep breathing, counting to 10, and that stuff doesn't work for the child, we may need to come up with something else, right? So it may need to be that they color, they squeeze putty, they squeeze some sort of a stuffed animal. Some individuals that I work with like to do things like crossword puzzles or word searches, right? To really focus their energy on that. The one thing that we want to make sure of, because our kids are so smart, right, is that it's not a highly preferred item or reward, right? So every time they're experiencing anxiety is not the time for them to be going to play that Nintendo Switch, right? We don't want them to be going off and doing that. And then the other thing that we would support the individual in doing, once they have a strong set of coping tools, they recognize that they're feeling anxious, with the support of a licensed professional, graduated exposures would be introduced. Meaning what we're going to do is we're going to put the child in a situation where they feel stressed or anxious, and we're going to help them face that fear in a predictable and successful way. Again, very important that this is only done with the support of a licensed professional to be able to make sure that this is a successful experience for the child. And lastly, one thing we might support the child in doing if we're seeing that anxious symptoms are severe, depending on the severity of the symptoms and the child's age, we may consider a referral for medication management. We may consider bringing that on board to help support the child in managing those feelings.
You know, that spectrum is broad. You go from a child who may be able to, borderline genius, to a child who may be nonverbal. How much more challenging is it for a parent or a caregiver of a child who is nonverbal experiencing that anxiety?
Absolutely. So I think they both actually present their own unique challenges. For a child that's nonverbal, it may be difficult, like we had talked about previously, for them to sort of report on what those internal emotional experiences are like. So I think a parent knows best, right? You can tell when your child is feeling stressed or anxious often by how they're acting, right? And so if we're noticing for them that they're starting to feel anxiety or stress, we might help them clue into, wow, this is anxiety. We may use visual supports to help them understand that this is anxiety and this is what we want to do to help you feel calm. There are definitely ways that we can support and address that across the spectrum for the child.
Okay, when should families seek professional support, and how do they go about seeking that support?
Good question. So parents' instincts are valid, right? A parent is right. If you have a concern or you are unsure of what's going on, or if something is sort of sitting with you and it does not feel right, seek support. Reach out to the child's pediatrician, call your insurance company, inquire about what services are available in your area. That would be first and foremost a time where I would very much encourage parents to seek support. Another time would be, like we talked about with anxiety disorders, if anxiety is interfering so much in the child's life and disrupting it so much that it's causing bothersome symptoms, physical symptoms, or they're not able to go about their daily life, that would be another time we would really want to make sure that families are seeking support. How you can go about doing this is contacting your insurance company. So you can ask for coverage of cognitive behavioral therapy, more commonly referred to as CBT. We know that this is an evidence-based practice for treatment of anxiety. One thing that I feel strongly about, and I think is important to consider for individuals with autism, is that there's also parental involvement in treatment. One thing we really emphasize in our clinic is that parent training component and that parent involvement, because as I said before, it's helpful for you to be able to support your child in using those coping skills and have an idea of what things you need to be working on outside of sessions with a trained professional.
Dr. Boon, from your experience, how many parents and families are probably unaware that their insurance company covers things like this?
That's a great question. Oftentimes in my experience, I'll have parents say that they weren't even aware that support was available, right? And I think that that's something that's really relevant now. We've been connected with a lot of families, very fortunately, and they were saying that, I just didn't think anything was available. And I would very much encourage parents to reach out to their insurance companies currently. Kennedy Krieger is one place that has been fortunate enough to be able to offer telehealth services, to be able to support individuals during this really unprecedented time. So we're able to support individuals from the comfort of their own home. Caregivers didn't even know that that was available, right? And I know that Kennedy Krieger, like many other organizations, are currently offering those supports and services. So I think it's important to check in with your insurance company and see what's available to support.
Absolutely. You talk about Kennedy Krieger, and I'm very aware of Kennedy Krieger. My son went through occupational speech therapy there when he was in elementary school. But another organization absolutely has been Pathfinders for Autism. And then you may have some people watching or finding out about Pathfinders for Autism for the first time, or watching the Zoomcast. How important are organizations like that to families in general, not only to the people on the spectrum, but also to the parents and the caregivers?
Right. Having a child or a family member with autism requires support for not only the individual, but the family as a whole, right? It really takes a village to be able to support that family member. And organizations like Pathfinders provide valuable resources and information for that family to be able to provide care for them and support them.
Yeah, absolutely. Dr. Boon, we thank you so much for your time. Is there anything else you'd like to say to the viewers of our Zoomcast?
One thing I think that I'd like to cover that we haven't had a chance to talk about is, how can parents or caregivers, sort of support their child? How can they sort of directly manage that? And I think one thing that I like to encourage parents to do is to validate their child's feelings, right? So we as parents hate for our child to be in any sort of discomfort or pain, right? We don't want them to experience any sort of stress. So the first thing that I hear caregivers doing is saying, don't worry about it. And really what that's communicating to the child is that there isn't anything to worry about, and it's not validating that, that may be a real feeling for them. So a different way to approach that would be to say, it's okay to feel worried. I feel worried sometimes too. Or I understand feeling worried about that. That makes me feel scared sometimes too, right? We really want to normalize that we also have feelings of anxiety or stress, that their friends have those feelings, that their siblings may have those feelings. And we really want to model how to express those feelings safely, right? So we might say things. Let's say you're stuck in traffic, right? You're feeling kind of stressed about being late for something. We might say, wow, I'm feeling really stressed right now. I'm worried that we're going to be late. And then we're able to then say, I know it's going to be okay. I'm going to take a deep breath and I know that we're going to get through this. So not only do we normalize that it's okay to feel that way, we also modeled really appropriate coping tools for the child. Another thing that the caregiver can do, as we talked about, is support their child in using the individualized coping tools that they've identified, right? So support them in using that logical thinking, support them in maybe getting, that stress ball to squeeze if they're feeling nervous. And then like we've talked about, and this is more important now than ever, I think, given everything that's going on and it's so unpredictable, is we want to try and make things as predictable as possible for children, right? So that might mean that we're following a consistent routine. We're using visual schedules. We're using things like timers to let them know how long things are going to last. We really want to increase that predictability as much as possible. And the last couple of points is we want to make sure we're supporting healthy habits in our kids. We can follow a good nighttime and sleep routine. We may support them in exercising or getting some of that energy out to make sure that they have some of those healthy habits. And last, but certainly not least, this is something I want to emphasize is that if your child is feeling stressed, or if there's stress, amongst a family member, then the parent is likely feeling increased stress and anxiety as well. So it's very important for the caregiver to be managing their own stress or anxiety. That might mean that the caregiver seeks their own individual supports. It might mean that the caregiver manages that by making sure that their child is getting appropriate services and supports, right? And is involved in their child's treatment. Whatever it may be, we want to make sure that the parent's really able to manage that. I tell caregivers often that you can't be filling up your child's bucket if you're feeling empty yourself, right? So that self-care is not only okay, it's necessary and it's important.
There you go. Dr. Boon, thank you so much for your time. And we appreciate everything you do for the parents with caregivers for people on the spectrum. Thank you so much.
Absolutely. Thank you so much for having me today.
We thank you for joining us once again for PFA Zoomcast.